Welcome, everyone, and thank you for joining us this evening. My name is Keisha Brooks Coley, and I'm Vice President for Federal Advocacy and Strategic Alliances with the American Cancer Society Cancer Action Network. I will be moderating this really great panel discussion we're going to be having this evening. The landscape at the federal level has changed a lot since this last election. And we are currently in the first 100 days of the new Biden administration and the beginning of the 117th Congress. We wanted to bring you all together this evening to talk about what the new administration and Congress mean for our cancer fighting work. Specifically, we're going to talk about the areas of research and prevention. And we have two amazing guests with us this evening. My first guest is Dr. Lisa Richardson. Dr. Richardson is a clinical oncologist and is the director of the Centers for Disease Control Division of Cancer Prevention and Control. In that role, Dr. Richardson leads 4 national programs: the Comprehensive Cancer Control Program, the National Program of Cancer Registries, the Colorectal Cancer Control Program, and the National Breast and Cervical Cancer Early Detection Program. Dr. Richardson works to break down barriers and reduce disparities in cancer prevention, early detection, and treatment every day. And we're really grateful that you're able to spend some time with us this evening. We're also joined by Dr. Brittany Avon McKelvey. Dr. McKelvey is a current American Cancer Society Cancer Action Network Science Policy Fellow, focusing on emerging science. Dr. McKelvey completed her PhD in molecular biology and genetics and studied biomarkers for thyroid cancer. Dr. McKelvey is a 14-year thyroid cancer survivor herself and also an ACS-CAN volunteer. So let's go ahead and get started this evening. I have a few questions to start our conversation. And also, I'm going to ask our guests, if you have questions, please put them in the chat box, and we will make sure that we'll have some time to answer a few. So I'm going to start with Dr. Richardson. Dr. Richardson, I know that you have worked at the CDC for a number of years. Can you tell us more about the work that you do every day?
So thank you, Keisha, and I'm really glad to be here with everyone this evening. So as Keisha said, most of the biggest program we do is the National Breast and Cervical Cancer Early Detection Program. That's really the flagship program of our division, and the oldest. This year is the 30th anniversary of the program. And so when we speak about health equity, that program is the ultimate health equity program because it serves women who have no other resources for screening. And ACS-CAN was critical in getting that legislation passed 31 years ago now, and with the program being implemented. And the other thing we're really proud of what we do every day is collect cancer data for making decisions about where to put our money in cancer control. So our cancer registry, at this point, we have a very nice online interactive system where you can even get cancer rates down to the congressional district level. So we're trying to provide resources for our partners to go out and do the work that we need done to keep us going down here in Atlanta.
That's great. I didn't know that this was the 30th year anniversary of the program. That's amazing. 30 years of a lot of really important screening and education and awareness work that the CDC has been able to do. So we know that President Biden and the new administration would like to accomplish a number of policy goals in the first months of the administration. Are there 2 or 3 priorities that you think are important from where you sit and you would like to see addressed that you could share with us?
So I think the biggest, well, for me, the biggest in the last legislation that was passed and the one that they're currently working on is really to build the infrastructure in public health again, which has really been, I wouldn't say decimated is sort of a strong word, but really hasn't been paid attention to much in the last 20 years. And I think a lot of the challenges we're having during the pandemic has been because we haven't paid attention to those systems that keep us healthy.
That's right. Wow. Very, very true points. I think we've all learned a lot over this past year about the importance for our public health infrastructure. In the past year, we know that screening rates have declined sharply since everything has changed because of COVID. And the National Cancer Institute data shows that we may actually see an increase in cancer mortality for the first time in 30 years because of delayed or missed screenings. So can you talk to us a little bit about what you think some of the implications will be going forward because of this? And also, do you see health disparities being exacerbated? And if so, how can we really think about how we need to be addressing this issue?
So that's a huge question.
It is.
Yeah, it's okay. So the first part, yes, we did see screening rates for all cancers, including prostate cancer, which is a blood test, just drop dramatically. And what we've noticed over the last few months or so, the end of the year, is that screening rates came back up a little bit, not back to baseline. And so what we think that'll mean in the future is that cancers will be diagnosed later, higher stage, more difficult to treat, harder to cure, and that eventually more people will die of cancer moving forward. So I think among the screenable cancers that Dr. Sharpless talked about in his paper, up to 1,000 deaths per year, excessive deaths in the next 10 years could occur in breast and colon cancer. And, I'm sure those outcomes will be disparate because they are already. And so the differences and gaps we see might be larger than what we see now. And I think what we can do about that is to be mindful that there are those left behind and not to leave people behind, and help everyone, but give extra attention to those who need it the most.
Great. No, I think we all realize that a lot of these disparities that COVID has shined a light on, they've been there, and now the COVID has really shined a light on how important it is for us to pay attention to these health disparities. So maybe that's something that actually out of this will allow us to approach in a different way than we have been able to in the past.
I agree. Yeah.
Great. Thank you, Dr. Richardson. Thank you so much. So I really appreciate the valuable insights. So I want to remind everyone watching that if you have any additional questions for Dr. Richardson, please put those in the chat box, and we're going to save the questions in the Q&A for after we talk to Dr. McKelvey. But so I'm going to turn over to you, Dr. McKelvey, and ask you if you could talk a bit more about your research and your work with ACS CAN.
Absolutely, and thank you so much for having me as part of the panel. So my work at Hopkins, at Johns Hopkins University School of Medicine for my PhD, as was mentioned in the introduction, was mainly focused in thyroid cancer and really trying to understand the mechanism of disease and how disease progresses. So how does a normal cell in your body become cancerous, and really looking at the cell's instructions, or the DNA, and looking at changes to the DNA mutations that alter how the cell is acting. And so in my case, I was looking at mutations or changes that cause the cell to grow exponentially, to proliferate, which obviously is a big hallmark of cancer and an issue. And so while my science was more on the basic science side, it does have applicability for future therapeutics. I was able to work with patient tumors that were taken during surgery to remove tumors after patient consent. And I really enjoyed that, but I now have stepped a bit away from the lab bench, to join the science policy world. And so I'm with ACS CAN as the science policy fellow, still using my scientific background, but focusing on the portfolio of emerging science. So that's really focused on clinical trials, access to clinical trials, FDA regulations, and regulatory science, which I really enjoy.
No, and we're so glad that you're able to be doing that important policy work with us. So I know that you're also a cancer survivor. And so could you tell us how that has impacted your decision to become a researcher?
Yes, it absolutely had everything to do with my path. So I was diagnosed when I was 13 with thyroid cancer. that was not something I think myself or my parents ever would have imagined hearing those words, "You have cancer," at that age. But it really brought out a fight or flight response, and definitely fight. And so we really focused on fighting the cancer that was within my body, going through multiple surgeries and radiation treatment. But once I was cleared, and I'm clear of disease now, that fight sense never really truly went away, and it turned into wanting to know everything I could about the disease, about how it worked, why it happened to me, and what we could do to stop it. And so that really led to my path in science, and specifically cancer research and studying thyroid cancer, my cancer, which can sometimes be a double-edged sword. I think it hits very close to home some days when you're studying your own disease that you had, but I think it has benefits. It's definitely, I can use my passion to help fight the disease, but also provide perspective, because I think sometimes as researchers, we can get so in the weeds with a research question that we forget to step back and think about how it impacts patients. And being a survivor, to have that perspective, to be able to shape questions that are meaningful for patients, I think is also really important.
No, absolutely. You have your personal story and you're able to provide that science background too, which is extremely powerful as an advocacy tool. So last question, you're in a unique position since you've dealt with this disease from all different angles. And from your perspective as a researcher, a survivor, and a volunteer, could you maybe share what are some ways our volunteers can make an impact on fighting cancer and health disparities? As we know, our volunteers a lot of them have their story and they have their personal story, but I think maybe you can provide some tips for some who are maybe trying to figure out how do they tell that personal story and do it well.
Absolutely. So, I want to first start off with advocacy is extremely important. And I think, ACS has shown how powerful that is. And we have made great progress. So, just looking from 1991 to 2017, we've seen a 29% decrease in cancer deaths in the United States. And that's something to be applauded. But we know that we also still have work to do, that cancer is still the second leading cause of deaths in the United States. And it's something to think about when we're pushing for increased funding for cancer research, like what I did, when you're looking for new cancer therapeutics or new diagnostics or prevention services. But I think sometimes we can get attached to that shiny new thing, and we can sometimes forget that we have these tried and true methods that we know work currently. And I think that's what Dr. Richardson has touched upon. And what's really important to focus today is when we look at screening, your mammographies, your colonoscopies, those regular screenings that we know can catch cancer early, which can make the cancer much more treatable, as well as potentially prevent cancer if we catch it early enough. And so when we think about prevention measures, and that about half of the 600,000 people that are estimated to die from cancer this year, that those are preventable deaths with current cancer control interventions that we have. And additionally, when we talk about disparities, we know that there's substantial geographic and racial disparities in preventable cancers such as cervical cancer and lung cancer. And so it's really focusing on that increased investment of equitable application of these current cancer control interventions we have, like Dr. Richardson has been talking about. And I think the National Breast and Cervical Cancer Early Detection Program is absolutely a shining example of that we can ensure that all Americans have access to life-saving screening regardless of their income status or their insurance status. And so I think as advocates, it's extremely important to use our voice that we have to let our members of Congress know that we want to support programs, to fully fund programs such as the National Breast and Cervical Cancer Early Detection Program. And so an action that all of those that are listening right now can take is to use their voice and text the words breast cancer. It's on the screen below me, to 40649 to talk about this very important program, to let your members of Congress know. I think such an important thing as advocates is your legislators want to hear from their constituents. They want to know what's important so they can focus their policies and agendas toward that. So never being afraid to let your voice be heard. And this is a very simple way to do it right now.
Absolutely. Wow. If you haven't convinced people who are listening tonight to be an advocate, I don't know what it's going to take. And from hearing from Dr. Richardson and your passion about the work that you all are doing at the Centers for Disease Control and Prevention, thank you both. So we are now going to turn over to a number of questions that we have in the chat box. We have a number of people who have put their questions already in. So this first question is going to go to Dr. Richardson. And the question is, our entire society has been greatly impacted by COVID-19. How has the pandemic impacted how you work daily at the CDC?
Well, there's several levels to answer that question. So within the CDC, since we're all work there, lots of us have been pulled away from our regular day-to-day work to work on the response for COVID-19. And so I would say at any time in our division, there's probably 10 to 15% of our staff are there working. Having said that, the states have had the same challenge as well. Over half of our states at least have had people at the state health department pulled off of our national programs to work on the COVID response in their states. So it's actually been multi-level. But we've had, people are really, the BNC program is really a passionate advocate program. So the people that work there are passionate. The people like you guys that go out and, promote funding for the program are passionate. So they've been able to maintain decent levels of screening and get women in to receive their mammography and cervical cancer screening. But it really has stopped us to sort of slow down and see what we do and look at the efficiencies, which has been really nice. So I think someone said earlier, the silver lining, you got to look for those. So, but yeah, it's impacted everything we do.
No, absolutely. I think we all have been looking at silver linings over the past few months. So completely agree with you there.
Yeah.
So another question, and actually maybe we can ask you both to answer this, but the question is, how can a layperson encourage our family members to get screened during this time when we know that they're reluctant to go out? And I know this is an important issue that both ACS CAN and ACS has been thinking about, and ACS has a partnership with the CDC on back to screening. And so maybe Dr. Richardson, we can start with you, and then Dr. McKelvey, we can go to you to get your thoughts as well.
So one of the big efforts we're doing that you just mentioned with the National Cancer Centers Network, ACS and CDC, is how do we message that going back in for care is safe? I believe it's safe. I had a mammogram done in June, which was, at the beginning of the disaster we're in. Everything was fine. I called the office first. They told me what they were doing to keep it clean between patients and sanitized. So I felt very comfortable going in. And that really is, in my mind, the best way you can get people to be more comfortable is to actually query the providers. Like, what are you doing? Are you following CDC guidelines? But even having said that, there's people out there who are really tough and it's hard, but we don't want people to neglect their care, because the cancer, whether you find it now or you find it 6 months from now, the cancer is there, and the earlier you find it, the better off we are as far as better outcomes. So, but yeah, just talk to your provider and see what they're doing. And if it doesn't sound right, talk to another provider, see what they're doing. So
good advice.
It's your health. Yes, it's your health.
Absolutely. Dr. McKelvey, did you want to add anything?
No, I mean, I would echo what Dr. Richardson said, and I think it's also about shifting perspective for our family members too. Obviously, COVID is very much in the forefront of everyone's mind right now, and that can be the one thing that we can kind of fixate on, but reminding our family members, our loved ones, about the importance of screening, and just because, that consequence with cancer is maybe further off in their mind, just the importance of, like Dr. Richardson said, again, catching it earlier, to have those regular screenings to help your health in the future, even if COVID is kind of more in the forefront right now.
Absolutely. So I have just a few more questions still coming in the chat box. And if you have a question, please put it in the chat. We have some more time for questions. And Dr. McKelvey, I'm going to ask a question that was put in the chat box for you. And the question is, access to care has become an even bigger problem during the pandemic, I think, as we all know. And the question is, what has it been like working on access to care issues through this crisis and issues around the need for affordable coverage and access to care, I guess from an advocacy perspective and the work that you've been doing with ACS CAN?
Absolutely. So I think, there's obviously been a lot of ramifications from COVID, but I think one glaring example is that we've seen this issue of access to care that has always been there, but I think has been very much highlighted by COVID. And so I think that it's something we need to learn from and move forward, that where someone lives or who they are should not determine what type of care that they receive. And when we think of access to care, that takes a lot of forms. Access to the current standard of therapy, so getting the best care that there is. That's also access to clinical trials. And again, that can be dependent on where you live, if you're going to a large research institution or a small community hospital, and access to screening and those preventative measures. So it's this holistic approach of a lot of issues around access to healthcare that need to be worked on, and hopefully that we're taking steps in the right direction to address that.
Absolutely. Great. Thank you for that. Dr. Richardson, a question for you, and it says that I'm wondering where you think we can expect the fastest progress in cancer control. And second part of the question is, are there any new ways of screening or detecting cancer that you find exciting, or ones that might change the way you do your work?
So for the first question, I've never heard prevention and cancer control called fast before, but but I'm always like, why aren't we moving faster? So
Faster,
I think the
right.
one for that, yeah, exactly. For that question, it's really how do we take what we already know and have it resonate with people, where they live inside their head and inside their hearts. We know how to prevent cancer, but people still don't exercise. They still don't eat, healthy diets. We're becoming more and more overweight. So what are we missing there? So that really, for me, in cancer control is why aren't our messages resonating with people and, causing behavior change? That's a tough one, but I think we can crack that nut though. We can send a man to the moon. I think we can figure out how to get people to exercise. Fingers crossed. Anyway, the second question is really about more taking control of and this sounds like the first part of the question too. How can we take more control,
Right.
feel safer with our care, those types of things. So what we had talked about before is at-home screening tests like the FIT test for colorectal cancer, or an at-home cervical cancer screening test, which is now with the FDA, to see if that is something that can be approved, with the caveat in mind that you're going to need follow-up if it's positive, but just other ways to deliver care that might be more in line with your beliefs, and definitely if you're scared of going out for care, that will be one way to handle that.
Okay.
So that's exciting as well.
That is exciting. It's helpful to know about these new kind of innovative ways that people can be approaching prevention. And it's been interesting too to see from a telehealth perspective how
Yes.
people have been able to receive care in very different ways than prior to the pandemic that we actually saw as opportunities. So another potential silver lining. We have to keep looking for them, right?
Yes.
So I have another question for Dr. McKelvey, and the question says, I loved hearing about your passion for your research that impacts those we all love dearly. And can you talk about why it is so important for you to be an advocate, and for those who are listening today, who maybe it's someone who has never advocated before and never gone to Capitol Hill and talked to their member of Congress, or never picked up the phone and made that call or sent that email, what would you tell them why, number one, why you think that they should be an advocate, and two, what suggestions you would give them on how they can engage.
Absolutely. So for me, starting my advocacy journey was when I was on the bench and in science, and I saw just the severe lack of funds that existed to do the research to help move cancer progress forward. You know, we have the best minds working on this disease, but if the money isn't there, then those new therapeutics don't ever get realized, and those could be life-saving treatments that we're leaving on the table. And for me, you know, I could sit back and complain as a researcher that there's not enough grant money in the world, or I could do something about it. And so for me, it was getting involved with ACS CAN and pushing for increased funding, using my story as a survivor and also as a researcher. But, you know, regardless of our personal stories, I think we can all agree in the importance of advocating for fighting back against cancer at all levels of government. And I think what makes ACS CAN so great is the ease in which with joining ACS CAN, you can get involved and plugged in. You know, you can see the priorities that we're focusing on that are extremely applicable, especially right now in the times we're living in. And, you know, from different templates about how to contact your legislator, telling you who it is, and kind of what the issues are. I think it makes it very digestible and easy for anyone to get involved, because again, I mean, our legislators are there to serve us, the constituents, and they need to know what we care about. You know, if they're hearing from 5,000 peanut farmers, then all right, peanut is a really big priority. But you know, we need to make, don't ask me where the peanut analogy came from, but we have to show that cancer is such an important issue for us and
Right.
topic for those policies to be pushed forward. And they want to hear from us. It's not a scary thing to talk to your representatives. They're excited to hear. And so I think getting involved as an ACS CAN advocate is extremely important and rewarding. It's very enjoyable.
Great. Well, there you have it, everyone.
That's great too.
That's exactly why we need people to be doing important advocacy work that truly makes a difference. And I know I've heard our volunteers say that please, you know, give us the words that we need to make the impact that we want to make. And that's what ACS CAN tries to do, is to help everyone find that story and be able to explain why the important advocacy work that we do is so important, and share that with the lawmakers who can make a difference. So I'm going to just, right before we close, because we're coming close to the end of our time together this evening, although it's been a lot of fun and I almost don't want to close. We have a comment that came into the chat box, not a question, but a comment, but I thought it was a really nice one that I wanted to share. And the comment was that the National Breast and Cervical Cancer Early Detection Program saved my mother's life. So thankful that she was able to have access to early screenings so that she can interact with her 3-year-old granddaughter. So, you know, Dr. Richardson, I know that makes you want to keep doing everything that you do every day. And thank you for everything that you do every day and the work that you do. And that program has saved many lives. And that's why we continue to fight and make sure it's resourced the way that it needs to be. Absolutely. And Dr. McKelvey, thank you for sharing your story and for letting those who are listening know how easy it is to be able to advocate and tell their stories, and know that telling their stories will make a difference. And I'm going to close by asking everyone on the phone to text breast cancer to 40649 to take action one last time. And I want to thank everyone for taking time out of your evening to spend time with us and talk about these important programs and work that ACS CAN is going to be supporting this year, and to talk about the important work that's happening during the first 100 days and the beginning of the 117th Congress. Thank you both, and thank you all for joining. Much appreciated for your time, and have a great evening.
Thank you for having us.
Bye-bye.